anything in the presentation, we will be sending out a recording in our e-tips that come out every Tuesday. So watch for those. And if you have any issues finding that, you can email us at the Weight Loss Challenge at slhs.org. So Todd Johnston, he's here with us. We're super excited because he has been a certified athletic trainer with St. Luke's Sports Medicine for 1 year. Is that right, Todd?
Yeah, just over a year.
Perfect. And Johnston works with other members of the Outreach Athletic Training Team to provide medical services to rural high schools, community events, club sports, and professional athletics. And before coming to St. Luke's in the fall of 2019, Johnston spent 2.5 years as an athletic trainer with the University of Nebraska-Lincoln football program. He possesses NFL experience. He spent the summer of 2015 as an athletic training student intern with the Seattle Seahawks and is just expert in the field for sure. I got to spend the day with him on Monday doing our squat clinics, and it was a ton of fun. So we appreciate you also taking the time, Todd, to do this online webinar for those who couldn't come to the clinic. So thank you for your time, and I'll let you just kick us off if you can share your screen.
Perfect. Sounds good. First thing I'm actually going to do is I'm going to get everyone up and moving.
Perfect.
So I'm going to turn my video on here. First thing we're going to do, guys, so let me tilt this up a little bit, is first thing we're going to do, everyone stand up out of your chairs, wherever you're at your desk. If you're watching, I'm standing up in the conference room here. First thing I'm going to have you guys do is pretend you're going to pick up something that's on the ground. So I've got a pen here. I'm going to pretend that I'm picking my pen up. A lot of adults, as we go through the process, we go through points in time where we develop bad motor patterns and movement behavior. So if I'm going to pick up a pen, usually I'm not going to think about it. So I'll tilt the screen down here a little bit. If I'm going to go pick up my pen, I'm going to bend down. Okay, as you guys can see, I had a little bit of arch in my back. I wasn't necessarily bending at the knees, keeping my back straight or keeping my core activated.
Hey, Todd.
Yeah.
It looks like some of the individuals can't see your video. Is there any way that you can share that differently?
Let me see.
It looks like some can see you and some can't. So,
Let's see. I tried to restart it. Did that work for those folks that couldn't see it initially?
If you can't see Todd, type in the chat box for me. Okay. Still, it looks like there's a few who can't.
We'll have later in the once I get to the PowerPoint presentation, I'll kind of have some bad examples.
Oh, okay.
Of movement patterns. So for those of you that cannot see it, does that work if we go through with those, kind of the bad patterns for picking up pens that I tried to demonstrate right there? Looks like that'll work for a few people.
Perfect.
Awesome. So as you guys are going through your movement patterns there, I'm going to go ahead and jump to the PowerPoint. So share this real quick. All right. Can everyone see that okay? Hopefully. We all good on your end, Mac?
Yes, it's good on my end.
Perfect. So we're going to go ahead and jump through our strong movement webinar. This is going to be kind of a similar track for those of you, if you're in the webinar here today, that were able to make it to our squat clinics at various locations. We had an awesome turnout, got some people moving and correcting some of those bad behaviors that us as adults just develop over time. If you watch a little kid bend down to pick something up, they're squatting down, their back is straight, they've got great form, and we just at some point in time throughout our adult lives tend to lose those things, and that can unfortunately lead to overuse or acute injuries. So the objectives for the webinar today, I'm going to describe benefits of strong movements, of doing them correctly in our daily lives and in the workplace, as well as some exercises to help get them stronger. We will also be explaining the steps of performing the hinge, squat, and lunge movements. So more of our lower extremity based powerful and strong movements. And we'll also have some video clips on the presentation to demonstrate unhealthy movements, as well as how to correct them. So for those of you that couldn't see my terrible example of picking up a pen, we'll show some later in the PowerPoint here. And finally, I'll be describing integration of strong movements into daily activities and how those movements work into our daily work lives. So correct and safe movement is extremely important. For injury prevention. Generally, overuse injuries can be a result of poor movement patterns, whether we are having some knee pain that gets worse, that has gotten worse over the last few years. Low back pain are common injuries as a result of those poor movement patterns. If we notice we're bending at the back a lot or twisting in improper ways, those can lead to some of those low back and knee overuse injuries. And also there's some costs of incorrect movement. So as we develop poor movement habits, that's going to continue throughout our lives. Where we start developing those, who knows? As adults, generally it's probably in our most active years, teenage and in our 20s, but those poor movement habits can lead to muscle imbalances. So some of our muscles might be too tight, and we notice tightness and perhaps pain or tendinitis type issues in those muscle groups, as well as some muscle groups that, for lack of a better term, turn off. So they're not, neurologically, we're not firing those muscles correctly to help us move through our daily activities safely and with the proper mechanics. So we're going to start with the hinge movement. The hinge movement looks exactly as it sounds. All of our movement is going to be happening at the hips, and we'll have a video on the next slide here to demonstrate that. So some things to remember with a safe and correct hinge movement is an active core. A lot of you may have heard that term and don't really know what it means, or when someone says activate my core, okay, how is that supposed to feel to me? Everyone's different. Everyone interprets those instructions differently. One thing that I've used in my experience with the wide range of patients and athletes that I've had the pleasure of working with is to kind of suck your belly button to your spine. So if you're trying to get your belly button as close to your spine as you possibly can. So we're not necessarily trying to activate those rectus abdominis muscles, those six-pack muscles, if you will. We're trying to activate the core as a whole to help support safe movement and help take some stress off of our back during these movements. One way you know that you are activating your core well is with a straight spine. So for those of you that were able to watch me pick up a pen, my spine was far from straight because I didn't have any core activation during that movement. And once again, that movement's only going to occur at the hips. So some examples in the workplace here at St. Luke's. Bending over to tend to a patient. Oftentimes that's something, whether it's a patient in the clinic or in a hospital bed, when we bend over to do things, oftentimes we're not really even thinking about it. We're thinking about the task at hand. But bending over, if you're doing that 50 times a day over a long career, that's going to lead to some potential overuse injuries. Another example in the workplace is going to be picking up or moving items off of shelves or off of your desk and maybe moving them to another location. So some examples of ways to strengthen that this movement, or perhaps things you may have used in your own exercise programs or have heard the terms. The deadlift is a good example of a hinge strengthening exercise to kind of strengthen this movement pattern if done correctly. So we've got some examples here. Mrs. Erin Barker was kind enough to be our example patient for these. So I'm going to start with the unhealthy example, which is essentially what I demonstrated earlier here in the webinar. So as you can see in this video, Erin is bending at the waist like she's supposed to, at the hips, but her back ends up being, I'm going to play it again, her back ends up being quite curved, especially in the low back as she's bending over to pick it up. Her knees aren't helping support the movement at all. They stay pretty straight. So as a healthy example, as you can see here at the bottom, Erin's spine is completely straight there for the most part, which means her core is active to help support her low back throughout this movement. She also has a little more knee bend. Erin is a pretty flexible person, so she's able to hinge down pretty far. If there was something on a box, for example, right here, or if she's picking something up off of her desk, she's able to do that safely with this hinge movement. A lot of us, myself included, are not that flexible, so we need to use other movements to kind of help us perform these correctly, pick things up correctly, which we'll show with the squat and the lunge later. So this is just an example of a safe and correct hinge movement. So thank you, Erin, once again for being our example for this. So some things to remember. So if you're going about your daily life or you're doing some physical activity in the gym or at home, here's some tips or tricks or just some terms to remember and to kind of think about, because part of the reason we are getting into these incorrect movement patterns is because we do them without thinking. They just become second nature for us to do. So an activated core, once again, we're not worried about those six-pack muscles in the front. We're worried about activating the core altogether. So sucking your belly button into your spine is the cue, that verbal cue that I like to give for that. We're keeping our spine straight throughout this movement. A slight knee bend, as Erin demonstrated in that healthy example video on the previous slide, and know your individual flexibility limits. So once you start feeling, as you're going towards the bottom of a hinge, once you start feeling your back starting to curve or your knees having to bend a little bit more, that's probably your limits. Most likely it's going to be a hamstring flexibility issue, and that's going to limit us from getting to all the way to the ground to pick that pen up or pick that item up off the floor. So if we've gotten down that far, how are we going to then pick that item up? For example, Erin was able to get about a foot off the floor, but she still wasn't able to pick that pen up. In that case, we're going to squat to get down to the bottom of that. So some examples of the squat in the workplace is going to be standing up or sitting down at a desk or at the cafeteria table, picking up and lifting items, and potentially moving patients as well. So some examples of also how to strengthen our squat or strengthen these movements so we're moving more efficiently and effectively. It's going to be, this is more in a gym-based setting. Some of these you can do at home. A back squat, and that can be done with weight or without weight. A leg press machine or box squats. So a box squat example would simply be just like sitting down, at a chair and standing up from that chair. So at the very bottom of that squat, we're kind of relaxing and then standing up from that chair. So we're going to do some examples again with Erin. Here, we'll start with the unhealthy example here. So as you can see, part of the issue with Erin is she's going to be driving her knees straight forward. She's not sinking her hips back and using her hips. Anytime our knees get too far forward like that, we're putting an unnecessary stress on the front aspect of our knees. So leading to things like patella tendonitis or certain cartilage issues with our knees. So that's something we want to avoid. Here's a front view. Another thing we want to avoid with the squat is our knees collapsing inward towards the middle of our feet. So here is click too far. Here's an example of Erin's bad squat. So her knees are collapsing in, as you can see in that video there. So that's something that we want to absolutely avoid. Here is a healthy example of a squat. We'll go from that side view again. So as you can see, Erin is sinking back, her hips are back, and she's using her glute muscles to do the majority of the movement. Her knees, as you can see here, are not going in front of her toes. It's okay to go over your toes a little bit, but not shooting super far forward like she was in the last video. And all of the movement is coming from her hips and her glutes, which is the biggest muscle group in our body, so we might as well use them appropriately instead of her quads and putting unneeded stress on her knees. And Erin's a pretty experienced mover, so she's able to get pretty deep, which is something that varies depending on the individual. Here's that front view. So again, we're wanting to avoid the collapse inwards of the knee. So as you can see, Erin's able to drop down pretty well without her knees collapsing in. So what are the cues, things that you should remember when doing a squat? So the first thing we want to remember is a firm base. The foundation of any building is the most important part, and that's going to be the same thing for us with our squat. Once again, similar to the hinge, we're looking for an active core, sucking our belly button to our spine. I'll keep repeating that to kind of drill it in, and keeping our spine straight. Our weight, we want that to be over the middle of the foot or over the heels. So in the first video, I'll go back to that real quick. From the side view, you can see that Erin's weight was pretty far forward. We'll go from the side view here, and her weight is more over the balls of her feet because how far she's driving her knee forward to keep that center of gravity. Whereas in the healthy video here, her weight is back to use her hips, so that's more over the heels and the middle of the foot. And our width on our squat, feet will be about hip width apart and toes slightly pointed outwards. The reason being for that is the way our anatomy is set up. That's a lot more comfortable movement for our femur, the ball of our femur, to sit in our hip socket. And if we point our toes outwards, we're going to avoid some pinching on the front part of the hip there. And we're going to focus on driving our knees outward. I'll go back to the healthy example again here. Once I can get my mouse, there we go. So as you can see, Erin's knees aren't collapsing in, and she's focusing on driving those knees outwards. Whenever she's doing that, the muscles she's activating, so if you guys want to stand up and do some squats right now, the muscles she's activating, and where you should kind of feel some activation, is on the outside of the hip, right here, kind of on the outside. That's the muscle group that helps prevent our knees from collapsing inwards. And so that's what we want to think about whenever we're going through the squat. Once again, to kind of correct these movement patterns, it's something that we need to consciously think about because we've been essentially unconsciously thinking about it as we're going through these movements inappropriately for years. So that outward knee drive is very important. And then once again, having the knees behind the toes. So as you're going through the rest of the day today, moving forward with the rest of the squat challenge this month, I challenge you to kind of think about these tips and tricks as you're going through those movements. That way, whenever, and we noticed it with some of our folks who made some awesome changes at our squat clinic, is that once you actually start consciously thinking about it, it makes it easier to change that movement and start moving a little bit more safely and a little bit more efficiently. So the last movement pattern is going to be the lunge. So I'll go back to picking up that pen example. If you don't have quite as much range of motion, you're squatting down, hips are back, but you still can't quite get to the ground to pick up that pen, or if it's a heavier item and you don't want to hinge down to pick it up too much and compromise your back, we're going to move into a lunge pattern. So examples in the workplace of the lunge are going to be, again, picking up and lifting items and potentially moving patients. If you're approaching the bed, for example, with the patient and it's a little bit off balance, to do more of a squat pattern with both legs next to each other, moving into a lunge to give yourself a little bit wider center of gravity, might be more comfortable. And examples of strengthening exercises at home, in the gym, whatever the case may be, are going to be walking lunges, reverse lunges, so standing feet side by side and dropping the leg backwards, and we've got a few examples coming up as well, and then stepping up onto a box. Those are kind of some examples on how to strengthen this movement once you get the movement pattern down correct. So here's our unhealthy example. We're going to start with the side view. So if you notice, Erin's starting in a pretty good position right here, but her feet are in a pretty straight line. And that's kind of how a lot of people do their lunge, but that can lead to balance issues. I don't know about you guys, my balance isn't that great. So I usually widen out this back foot, and we'll show that with the healthy example. But her front leg is going to somewhat mimic a squat. So if you notice her front knee angle with this lunge, and remember back to the unhealthy squat example, they are essentially similar, right? So she's driving that knee forward, putting a lot of unneeded stress on the front of her knee, on her patella tendon, and she's kind of wobbly when she comes up to the top. Especially on this rep here, because of not having a wide base. And here's our front view. You'll also notice this knee starts collapsing in a little bit. She's wobbly, those feet are kind of in a straight line, and that knee starts collapsing in a little bit on us and puts unnecessary stress on our knee. So with our healthy example, some of the cues, and we'll get to that with the tips and tricks, but as you can see, the starting position looks pretty similar here with the side view, but if you look at it from the front, you can see she's got a wider base, so she's not lining up that back foot right behind the front leg. And also, so the starting position is similar from the side view, but instead of Erin's knee going forward, what I want you guys to kind of visualize or think about is the merry-go-round or carousel, how the pole's going through the animals that you're sitting on, and they drop straight down that pole on the carousel. That's kind of how we want to move with our lunge. So Erin's going to get her wider base there, and she's dropping straight down. That knee is not going in front of her toes. And this front leg is going to essentially be the same movement as our squat. So as you can see with Erin, if we were to go back and go side by side with her squat, that's pretty similar movement. So that front leg is using these glutes to help with the movement and propel her upwards. The back leg will have a little bit more quad activation, but the front leg should feel similar to a squat. And same thing with this movement here. As you can see, she's driving this knee outwards, and that's going to be a similar squat movement. Erin's smiling because she had done like 100 of these that day, so she's a little bit tired at the end. So tips and tricks for the lunge, things to think about as you're going through these movements, whether you're wanting to exercise these movements a little bit more efficiently or just moving around your daily activities throughout life. So that wide base, and that's just going to help us with our balance, and if we're falling off balance, that knee can start collapsing in, as we showed in the initial video. Avoid that front knee collapsing inwards, and then the front leg, think about your glute muscles propelling the body upwards, and the back leg's going to have a little bit more quadricep muscle activation. And finally, dropping straight down. So our weight isn't going to shift forward as we're dropping downwards in the lunge. It's going to be moving straight down that pole in the merry-go-round example. So now I'll be able to take some questions from you guys. Mac, do we have some in the chat there?
Yes, we do, actually. The first question is there a limit with artificial knees?
So the biggest issue with artificial knees is going to be depending on after that surgery and depending on how much range of motion you gain back with your rehab. What we're going to want to avoid is going to be the same movement pattern in our lunge, right? We're just going to want to be doing healthy things. So for lunge or for the squat, for example, and I'll Oops, looks like I unshared on accident. My screen. For that movement pattern, we want to not drive our knees forward. That's going to put some unnecessary stress on that artificial knee and on the new hardware you have in your body. So we want to, with our lunge, since this is a slide I'm on, if you're bending down to pick things up, driving this knee too far forward is going to put a little bit of unnecessary stress on that new knee. And then as far as the depth of these motions, that's just going to be kind of dependent on how much range of motion you're able to gain back after surgery with that rehab protocol.
Thank you.
Mm-hmm.
It looks like you are already answering Christine's question. It says, can you show Aaron's healthy lunge again, please?
Yep, I saw that one pop up.
Perfect.
We'll hit this front one again too. And it, for people, oops, that's not. And I know I've seen, working even in athletic populations, the lunge is an exercise that's often done incorrectly. The wide base is something that people don't think about. They try to line that back leg up right behind their front leg, and I definitely was guilty of this for a long time. But going off balance is going to lead to that knee collapse in, which is something that's going to lead to potential further overuse issues.
Great. Are there any other questions for Todd? Okay, it looks like there are none. So
Awesome.
Thank you so much, Todd, for your time. If you can send me your slide deck, Todd, I will also share that with everyone. If you can just send it in a PDF form, that would be great.
I will do that, and I think
Hey,
this.
Mackenzie.
Oh, yes.
Sorry, this is Erin. Hey, I was just going to remind anybody that's attending the webinar that if there are opportunities to come to the departments to kind of help their teams learn how to do these movements in person, that they can just send me an email, and I'd be happy to see if I can coordinate that would work best for everyone.
Oh, great. Erin, can you type your email? Actually, I can type your email into the chat box. One second.
You.
Of course.
Because I know I've gotten a few requests to come, especially for our clinical teams, to come directly to the department, and I can try to convince Todd to come with me too, if I can't make it work. So just to throw that out to our folks on the call.
Thank you. Okay. Erin's email should be coming through the chat box. Great. Well, that is our recording, everyone. Thanks for attending, and watch for the e-tip with the recording.
Thank you, Mac. I appreciate it.
Thank you, Todd.
Thanks, everyone.